Hey, this is Lambs on the Lamb, a middle-class midlife makeover in Costa Rica. Glad you guys have joined us. I cannot believe what happened. And so I don't want to even get into it. Mary's going to tell you what happened. It's amazing.
Okay, so on Tuesday, this is a little personal. Okay, so we're bringing you into the fold here a little bit. So on Tuesday, I really had to go to the bathroom. And something you need to know about me is I used to be a teacher and I have a bladder of steel. I can go hours without going to the bathroom. I don't get UTIs or anything like that. That's just how I'm made. Okay. So Tuesday morning though, I wake up and I really have to go to the bathroom. And then like an hour later, I really have to go to the bathroom again. And yet I go to the bathroom and there's like nothing there. You know what I mean? And again, a little while later, I'm thinking, okay, maybe I'm getting a UTI. Maybe I should like go to the doctor or something. Well, then by the afternoon, I seem to be fine again. And then Wednesday was fine, and Thursday was fine, and Friday was fine, and everything was fine. I thought, okay, I guess I dodged that bullet until Saturday morning. And I got up and I had to pee. And I mean, I had to pee. And then again, half an hour later, I'm in the bathroom again and again and again. And like 6 times in the first 3 hours of my day, I had gone to the bathroom. And I thought, this is wrong. This is wrong. I need antibiotics. I definitely have a UTI. We need to go to the doctor. So,
right. So from me being Mr. Practical, obviously I want her to be healthy. And at the same time, in the back of my mind, I'm going, great. You know, I know all of the doctors are closed on a Saturday. It's a Saturday. So that means an emergency room downtown at the hospital. That's not really a hospital, but has everything but hospital beds, I believe. They do imaging, they do MRIs, they do labs, they do all the things. And I'm thinking, oh man, this is going to be expensive. But again, what are you going to do? It's Saturday. Right. You got to get this taken care of. She's not going to last 2 more days. That's just misery. So here we go to this expensive appointment.
Right. I had called and I said, are you open? They're like, yeah. I said, well, okay, so here's my deal. I think I have a UTI. What do I do? And she said, well, we can make, and this is about 10:30, 10:45. And she said, well, we have an appointment available with Dr. Rojas at 11:30. And I was like, oh, okay, yeah, definitely. I will absolutely be there. So we show up, check in real quick. She's like, yeah, you just wait down there at the end of the hall and Dr. Rojas will be right with you. So we sat down and he really was right with us. Like less than 5 minutes later, he comes out and he's like, Mari? And I said, yes, because that's how they say my name in Spanish. And so and I thought, okay, is this a nurse? And he turns around and he says, my name is Mauricio. He doesn't even call himself Dr. Rojas. Right. He calls himself Mauricio. And I'm like, okay, hi, Mauricio.
And I didn't figure it out until we got in and sat down and I saw the diplomas on the wall. I'm like, this guy's the doctor. And he introduces himself as Mauricio.
Right. And so we sit and I tell him what my symptoms are and this is what's happening. And so he said, okay, well, we need a urinalysis. A few more minutes. Here comes the lab tech. She takes me in. She says, okay, we're going to get a urine sample. Great. I go tend to that, give it back. And she's like, okay. And so I pay for it right there with her. And so then we come back out, sit down again and wait for the doctor. Maybe this time we waited as much as like 10 or 15 minutes. And he comes back. He sits us down. He says, okay, here are your results. I'm sorry to say you have a kidney infection. And these numbers should be less than 10 years or literally uncountable. And these should be less than 5, and yours are uncountable.
Off the chart.
Off the charts. And I'm thinking, oh my gosh, how did I not know that I had? He was like, do you have pain when you go to the bathroom? Is your stomach hurting at all? Do you have nausea? And I'm like, nope.
I thought it was really nice that he actually described the lab results and then turned his laptop around and showed us the numbers and highlighted each line. So we knew exactly what he was talking about, what the numbers meant.
Right. And within a few minutes after that, on my phone, I got the lab results. The same document he was looking at was now on my phone. They sent it directly to me. Okay, well, thanks.
Right.
What doctor in the States does that? Sends you your lab results to you.
At that moment.
Happen. Yeah.
Right.
So we were just very thrilled with that. And then when all is said and done, the pharmacy's right there. We pick up my scripts. Not a problem. We are in and out in less than an hour. Lab work, doctor visit, prescriptions, done in 56 minutes.
And it wasn't like there wasn't anybody there. The place was, I wouldn't say crowded, but it was busy.
Sure.
And so to get in on a Saturday that quickly and all the things done,
we were floored.
Yeah, because the physicians we've had experiences with in the last 10 years, that is not, I've waited, anyway, I won't even get into that. It was,
to see a doctor.
Right.
And that you had an appointment with.
Right. Yeah. So I was so impressed. And then my concerns about, since we don't have health insurance yet and we're paying out of pocket, how much do you think an emergency room visit on a Saturday morning is going to cost you wherever you live, whatever that number is in your head? I know for us, it's going to be 4 figures, easy. It's going to be well over $1,000 for sure.
And with the doctor visit and the lab and the prescriptions with no insurance.
Right. And then they're going to bill your insurance. Anyway, it's going to be this whole long process and all the things. And this whole process cost us $125.
US dollars, $125.
Yep. So
that's it.
Yeah, you've heard, if you've been doing research on Costa Rica, private healthcare is very affordable. We're chiming in and adding another tick mark to that. Yes,
absolutely.
Private healthcare is not only very, very good here, very fast, but also very affordable.
Mm-hmm.
So we've also done some other videos about things that you might be impressed with in Costa Rica, much like we were impressed with our visit. We were
super impressed with this visit.
Right. So the doctor's visit, that's something we're really impressed with. Check out this video on some other things that aren't doctor's visits, but are pretty cool things to know in Costa Rica before you get here. They surprised us for sure.
For sure.
And be sure to like, subscribe, share, send us a comment. What other adventures do you want us to go on? Maybe I should go break a leg and see how I get that fixed on a Wednesday night. I don't know. Not that I would do that. No, let's not. So that's all we have for now, I think.
I think so. And I'm on the mend. Just so you know, I got antibiotics. I am on the mend.
Yes. That's the most important thing.
Yep.